Hello, I'm Dr. Courtney Glos. I'm a pediatrician with HealthLink. I'm here today to discuss a few things that you should know to help keep your baby safe when they are asleep. Did you know that placing your baby in a smoke-free environment at all times, including during pregnancy, can drastically reduce the risk of SIDS? Smoking in the home increases the risk of sleep-related infant death, also known as SIDS, for a number of reasons. It impacts brain and lung development. It can increase a baby's susceptibility to viral and bacterial infections. It can cause arousal abnormalities, taking longer to wake up when you're exposed to stressors. It paralyzes the cilia in the lower respiratory tract. That's the fancy name for the hairs that line your lungs. Yes, you have hair in your lungs. But that can lead to mucus clogging in the air passageways. Additionally, smoke and toxic chemicals can be transferred to the baby through third-hand smoke, which is the smoke and chemicals left on the clothes and other surfaces. The risk of SIDS is even higher if a parent who smokes shares a bed with a baby. Did you know that more often than not, better than 80% of families had an appropriate sleep space for their baby, like a crib or a pack and play, available at home, but they just weren't using them? When you're away from home, whether it's an emergency or a trip that's planned, and a crib is not available, a pack and play is a great alternative to a crib. We recommend that you only use a thin, firm mattress. Never pad it with pillows or blankets, and don't put anything extra in there no matter how cute it is. Car seats or bouncy seats are not good alternatives. Babies have trouble keeping their heads in an acceptable position on their own so that their heads can fall forward, which can block the airway and lead them to suffocate. Sofas, couches, or chairs are also not good alternatives because the baby can get trapped with their face pressed up against the side or back, making it hard to breathe. Babies are very, very good at exploring movements and getting into trouble. They are very uncoordinated and not very good at getting out of trouble. Did you know that pacifier use during sleep has been shown to reduce the risk of SIDS, even if the pacifier falls out of the baby's mouth? The American Academy of Pediatrics, also known as the AAP, recommends offering a pacifier to infants at naps and bedtime. It's okay for a pacifier to fall out of the baby's mouth while they're sleeping, and you don't have to go back in and put it back in their mouth. It's also okay for a baby to refuse a pacifier. A pacifier may help babies breathe by keeping their tongue forward in their mouth and preventing it from blocking their airway. It may also help the babies wake up if they're having trouble breathing because they don't sleep as deeply when they have the pacifier. The AAP recommends using pacifiers for infants up to 1 year of age, which is when the risk of SIDS is the highest. If you're breastfeeding, you should wait until you and your baby have a good rhythm with the breastfeeding before you introduce a pacifier. There's a lot of mixed reviews out there on when exactly. A lot of places say a month, but once you guys have a good rhythm, remember that you're not a pacifier if you're breastfeeding. Did you know that your baby only breathes from their nose until they are 4 to 6 months old? Babies who breathe through their mouths while sleeping may have a blockage in their upper airway, such as stuffy nose, allergies, or the viral infections that we see so often. This can be a symptom of airway restriction and may have long-term health consequences if left untreated. Each year, there are approximately 3,400 sudden unexpected infant deaths in the United States. These deaths occur among infants less than 1 year old, in which the cause is not obvious before the investigation. These deaths often occur during sleep or in the infant sleep area. Common types of SUID include sudden infant death syndrome, accidental suffocation, and strangulation in the bed of an unknown cause. Here are 6 things parents can do to keep your baby safe. Put your baby on the back for all naps and at night. Use a firm, flat surface for sleep. Never sleep with your baby. Instead of bed sharing, room share with your baby. Keep soft objects and loose bedding out of your baby's sleep area. Do not let your baby get overheated. Keep in mind, all these recommendations are for babies up to 1 year of age. Talk with your pediatrician if you have any questions about any of these recommendations.